that was infected was 9. We had about 148 confirmed cases in the schools. The total recoveries are 132. Currently, we have only 16 of them who are active that we are being followed until we de-isolate them when they have done the 14 days or 2 days after presenting no clinical condition. The workplace infection still remains a challenge, but in the last few weeks, we've had the last 2-3 weeks, we've had significant reduction in outbreaks in our schools, in our workplaces. We have so far recorded about 659 cases that can be said to be a workplace-related infection, and that's quite significant. That is since October to date. And so that's why in the last few weeks we've been talking about improving workplace arrangement. But we have seen that there's a reduction in the numbers coming there, so we believe that they are also taking heed to the cases that we are talking about. With all that, we have 4 active cases left. What means is that these were the early stage. In the last few weeks, a lot of them have recovered, and we are not getting new cases from the workplace. So we want to congratulate the workplace people for taking the heed to this, and I think it's also helping us a lot. There's another group of evacuees, and that is quite important. So far, we have brought in those who were just voluntary returned and those who were deported, about 9,265 of them. We've tested all of them. 984, which is about 10.6%, are positive. That's quite a high positivity rate, and so that tells you that the policy was important, that we needed to isolate, test them before we release them. But the main reason why we are here is the case that there are preparation for emerging events, major events that are coming up. We have the post-election activities. We have Christmas coming, and we have the school reopening in January. I will concentrate more on the first two. What are the risks for the post-election and the Christmas? I'll mix them up to 12. For the Christmas, there's going to be increased commercial activities, and that obviously increases the risk of spread. And especially where we have the majority of the cases in Accra, and commercially people are coming to Accra to buy and go and sell in the other towns, that creates another area that we need to be careful about. So these are some of the risks, that's the reason why we need to up the game as far as the use of protocols are concerned. There's going to be increased travel within. Around the Christmas time, people are going to crisscross the country, and that's another risk. There's also increased social activity and gathering for Christmas. People are going to have parties and meet, and these are all the spots that we need to look at to ensure that we don't have the spread. For the election, our challenge is that the queuing for voting. Fortunately, I went around a bit, and I also had a Ghana Health Service also distributed, gave Electoral Commission some masks to give people who don't have masks across the country. Queuing is a risk, but a large number of our polling stations, because of the fewer number, we didn't see the large queues that would have led to the risk. Of course, celebrations and the jubilation is another risk, and so we need to ensure that is also done. Schools are a regular mass gathering every morning, and so that's the risk that we are looking at. So looking at that, we are trying to ensure that people adhere to the protocols. Until we have a vaccine, the only vaccine we have is the mask. You see, and we need to address it. But we will intensify our advocacy, either with the school authority, with all chiefs, etc., to ensure that all these events are carried out in a way that reduces the risk of transmission and people are protecting themselves, and especially compliance with mask wearing, hand washing, and social distancing. We will be observing, we have mapped out the areas where we saw queues, where there was a delay in commencement of elections, so the large crowd, the district have been alerted to observe enhanced surveillance to ensure that if there are any outbreaks or any cases are coming up, they are able to quickly identify them, isolate, and as we know, we will then use that to contain the virus. We will continue our public education. We'll be hearing a lot from Dr. Acosta on the use and adherence to the protocols. And so our appeal is that the next 1 month is going to be a period, especially not just for the Christmas, but as we prepare for Christmas, it's a time that, and also the weather is dry. Dryness seems to also aid a bit of it, the transmission. So we need to be more cautious so that we can enjoy our Christmas. And in January, when schools reopen, we'll move in there. If you enter January with fewer cases, the risk of somebody carrying from home to school is reduced. And so what we do this month is very, very crucial. And once again, let's adhere to the use of the mask, appropriate wear, not just chin masks, but the one that covers your nose and your mouth. Thank you very much, Honorable Minister.
Thank you, Doc. Before you go, there's a specific thing I want you to address. I think informally we have spoken about it, but it's important to address it here. Looking at the footage you've seen on television and things you've seen online with large numbers of people outdoors celebrating, almost no regard to COVID protocols, are you preparing for a potential surge in COVID cases? You've mentioned Greater Accra has some numbers, etc. Are you preparing for a potential surge, or you are just adopting a wait-and-see approach, looking at what you are seeing out there?
That's why we have actually enhanced our surveillance, which means that we are going to observe more keenly. The slightest sign is picked up. We also know where there are potential points where there were large jubilations, where there were queuing, among other things. And so the district there will enhance surveillance to ensure that anybody who reports any similar condition are quickly picked up and identified. And of course, we intensify our testing in such areas at the least sign that we find. So those are the areas we are talking about. But the most important thing is that if people abide by the protocols now, we will be able to minimize whatever possible surge we have. We have a chart of many countries that had an increase in their COVID situation after election, but there are also many other countries who were able to contain and actually brought it down. Korea is one of the examples, and so we are trying to adapt the same mechanism that we are doing. But fortunately, the way the election itself was conducted actually reduced the risk of spread. There were fewer queues. A significant number had masks, at least the ones I visited and those I saw on television. Of course, there were some who were not wearing masks, but we are hoping that this will not be a spike, but we are enhancing surveillance to be able to quickly identify and contain.
I hear you. I hear you. So if I get you well, the Ghana Health Service is enhancing COVID surveillance and testing following the election activities and ahead of the Yuletide celebration. I hear you. I hear you. Colleagues, if you have questions, I'm happy to take them. Let me reiterate. The first part of our brief was on politics and election matters. The second part of our brief has been on the COVID situation. If you have questions on either, happy to take them at this point in time. Any questions? Do you have a question, sir? Please step forward. Do you have a question? Please step forward.
If I can say, the way the media covered the election, I hope they give the same attention to COVID.
You are worried they've moved on from COVID, eh?
Yes, they should give the same attention, especially education on the protocol wearing. Very helpful.
Yes, sir. Please introduce yourself and let's hear your question.
My name is Manuel Kranting. I work with JoyNews. My question is on the first part of the briefing on the election matters. Well, there are about 5 deaths which were recorded across the country. That's been confirmed by the police. Well, the NDC alleges that government unleashed the army and so on to some of these polling stations to, as it were, intimidate their supporters and, in their words, steal the elections for a government. I want to take your response to that allegation and what the briefing has been that you've received on these particular cases of violence. Also, we know that the NDC supporters are massing up at the offices of the Electoral Commission, demanding an immediate declaration, or if you read declaration, in favor of their candidate. We want to also take your response on that bit of the incident. And then on COVID, you mentioned, Dr. Patrick Mabaje, that the cases are rising at the airports, the positivity rate is rising at the airports because of the importation from European countries and so on. As we enter into the Christmas festivities, want to know whether there's going to be, if you like, an alert that's going to be issued on specific countries from whence we are not going to admit people into the country. Thank you very much.
So are you contemplating a travel alert as cases are rising from some particular countries? Yes, sir.
Yeah, thank you. My name is Arthur Mensah from Ghana News Agency. Doc, I want to find out Ghana Health Service plan to distribute personal protective equipment to schools since I learned schools will reopen in January, especially basic schools. What are your plans for distribution of personal protective equipment? Then my second question to Honorable Minister regarding the elections. During the elections, when President goes around, he said people should vote for MPP, boom, boom, boom. And so all of us were expecting that the margin of percentage should be around 57%.
That's your expectation? That's
my expectation.
Okay.
Because looking at the crowd and then cheering, we're expecting the margin will be very wide. And based on the government updates on some of the achievement and then infrastructure, I think people were expecting that the margin should be wide. Are you surprised that the margin is very slim compared to what the opposition NDC got and what MPP got? Are you surprised that people did not really heed to that call for boom boom?
Okay.
Then the margin of parliamentary seats between MPP and NDC. Some political pundits believe that it's going to be hectic for the government since the margin between the MPP and NDC is very close. And so if it did not work out things well, the president will find it very difficult passing laws, legislations, and then maybe some of the policies will be very difficult to be implemented. What are your plans to ensure that these policies go through? Thank you.
Thank you. Are there other questions? Or we should bring down the gavel after this set. Are there other questions? Okay, so let me respond to the, or perhaps, Doc, let me let you deal with the COVID ones. There was one about PPE, and then another about whether or not you are contemplating a travel restriction at this time. Recommending a travel restriction at this time. Then once you take your seat, I'll deal with the other matters.
Yeah, thank you very much. Yes, as we did with the reopening of the SHS3, SHS2, we are preparing and we are going to give PPEs, not only PPEs, sanitizers, etc., for schools to prevent any spread. And so the team is working to ensure that we have the adequate numbers prepared for them when school reopen, not just for the pupils, also for the teachers, as was done. We are also going to do enhanced education. We are preparing a special package for the younger kids, the lower primary and the rest, because all our messages are actually directed towards the adults. So we are preparing another message that we hope the media will help us to roll out, how we can ensure that these kids get the information they need. So I don't go to school and say, let me say, I like your red mask, so let's exchange your blue with mine. And so we need to have a special message also for them on how to adhere to that. And so we're going to also align enhanced surveillance in the school, just like we have done in the secondary school. That's why we're able to pick up those cases. Engaging teachers, we're working with education closely to ensure that we have our facilities linked to their schools and that we have the school health teams visiting and making sure that all cases are picked up quickly. So that's what we're going to do. So what we are going to do now is even much more intense compared to what we did for the JSS 2, 3, and SS3, JoyN3. Travel alerts. We have, in fact, that's why we have that system in place. We are ensuring that we currently have the capacity to test everybody who arrives at the airport with a relatively high sensitive test kits that will be able to tell us who is positive. The most important ones who are tested positive, you are isolated, and then you are sort of managed. The pre-travel PCR test also reduces the number of people who would have come into the country, especially already positive. You are not going to come because if you're positive, you will not be allowed to travel. So that system still helps us still contain the number. I can imagine that if we were not doing the pre-travel PCR test, we would have seen the number of people who have come in. There's a significant number of people who test positive, and because of that, they are not able to travel. There are Ghanaians who are trying to travel, they test positive, and they can't travel. And I think these two systems in place protects us enough that we don't think we are currently, there's any need to provide any travel alert to anybody coming in. Thank you very much.